Pregnancy is a time of multiple advices and instructions. Eat this, don't eat this. Walk this way, don't lift this. And now there are instructions how to sleep. So can your sleeping position affect the health of the baby? Let's understand this today. We doctors definitely recommend women to sleep on their left side. So what is the logic behind this? Let's understand a little bit of normal anatomy. It is actually all about the blood flow going to the baby. So we have major blood vessels running at the back parallel to your spine. So we have one big artery which is known as aorta. It starts from the heart and it carries the oxygenated blood right down below to the lower part of the body, including your uterus. And then we have a big vein. This is called IVC, inferior vena cava. Now this big vein carries the deoxygenated blood back to the heart from the lower legs and of course the uterus and the pelvis. And then we have a big growing uterus in between which lies over these blood vessels. So as the uterus becomes bigger, it actually causes compression of the blood supply, thereby reducing the blood supply to itself and the baby. So in case a woman lies on her side, now the pressure of the big uterus on these blood vessels is taken off and it theoretically improves the blood flow to the uterus and the baby. So for this reason, many times we doctors, in case there's a woman in labor and she is having fetal distress or a drop in the baby's heartbeat, we immediately turn a woman on the side. Also, the compression of the blood vessels also restricts the blood flow back to the heart, resulting in increased swelling in the legs. We all are aware that pregnant women have a lot of swelling in the legs and the feet. So, in case a woman is lying on her back and the big uterus is pressing upon the blood vessels, it actually restricts the blood flow back to the heart. Left or right? So sleeping on the left side is often referred to as the ideal position during pregnancy. So now let's understand why the left side is better. So number one, normally the uterus is dextro-rotated, which means normally the uterus is slightly tilted towards the right side. So when you lie on your left hand side, the pressure of the uterus is taken off better off the blood vessels when you're lying on your left hand side. Imagine if you were lying on the right hand side. Obviously, the tilt of the uterus becomes all the more and the compression of the blood vessels becomes even more. Also, the second part is the IVC. Remember the big vein I spoke about? The IVC runs on the right hand side. So, in case you tilt on the right hand side, the compression of the IVC will be more. While in case you lie on your left hand side, the compression of the IVC will be lesser. Third, sleeping on your left hand side takes the pressure off your liver, the kidneys. This means more room to function properly, helping in the swelling issues in your hands, ankles and feet. So remember, the best sleeping position is on your left hand side. The next is on your right hand side and the last is on your back. We need to also understand that no one can sleep in one position throughout the night. It's absolutely okay. Do not get paranoid about this. Whenever you remember, you can come on to the left side, or maybe in the night your husband can gently nudge you into the left side. So do not panic in case in the morning you find yourself somewhere else. Sleeping on your stomach. Doctor, I like to sleep on my stomach. Can I do that? You sure can. At least in the early pregnancy, stomach sleeping is okay until you reach about 16 to 18 weeks of pregnancy. At this point, your bum may actually be growing a little bigger, making this position uncomfortable and less desirable. So it may actually feel like as if you're sleeping over a watermelon. But don't worry, it doesn't harm the baby. The uterine walls and the amniotic fluid protects the baby from being squished. To make this position more comfortable, you may consider purchasing a stomach sleeping pillow. Yes, of course, you have a stomach sleeping pillow also available these days. So some of them have actually a large cutout for your belly. Sleeping on your back. So after 4 months of pregnancy, sleeping on your back is actually not a great idea. It makes you feel uncomfortable, it's harder to breathe in that position, it increases the swelling in the lower legs and feet, it decreases the blood flow to the uterus and the baby. Also, sleeping on your back increases the back pain, pregnancy piles, digestive issues, poor circulation. It also might make you feel lightheaded or dizzy. But once again, do not feel paranoid in case you find yourself in the middle of the night lying on your back. So it's absolutely all right. So now let's talk about how should you sleep in different trimesters. So first trimester. As the size of the baby and the uterus is very small at this time, any comfortable position, including on your back, is absolutely fine. In second trimester, as your belly grows, sleep on your side. Left is better than the right for the reasons I explained you earlier. Like I said, please do not worry in case you find yourself on the right side. Invest in a good mattress at this time. Make sure that the mattress does not sag. Now is also a time to think of buying a pregnancy pillow. Internet is full of recommendations for a good pregnancy pillow. So I'll give you 2-3 options. So pregnancy pillows are actually huge pillows and they come in U-shape or C-shape sizes. They actually wrap around the body in such a manner that it actually prevents the sleeping on the back and it helps you with the side sleeping. So you position the pillows so that it runs along your back and then hugs the front while simultaneously slipping it in between your knees. These long pillows can fit any height and can provide additional relief for your changing body. They can help with the aches and pains, and later on they can also double up as a breastfeeding pillow, but they occupy a lot of space, so be mindful of that, and they can be a little expensive too. We also have wedge pillows. These are like a wedge and they can fit wherever you need support. So if you're lying on your side, in between your bump and the bed, behind your back, in between your legs. So you can use them at multiple places, and they are small and they do not consume much space. In case you don't want to invest in a pregnancy pillow, C-shape, U-shape or a wedge pillow, you can also do with the normal home pillows, slightly longer pillows. You can keep one in the front, one at the back. That's also perfectly all right. Now coming to the third trimester. So continue using the pregnancy pillow for support. If you simply can't get used to sleeping on your side, try using pillows to prop up your upper body at 45-degree angle. Now this way you are not flat on your back and you also take the compression of your IVC, which is inferior vena cava. Alternatively, you can also try elevating the head of your bed a couple of inches using some blocks. So there's a lot you may be worrying about during your pregnancy, but your sleep position doesn't need to be at the top of that list. Soak in all the sleep you can before the baby is born. You might be seriously sleep deprived later. So today, like always, if you found this information useful, please do not forget to like, share and subscribe to Maitri. You can also find detailed information on the maitriwoman.com, and I will see you soon.